This is Debbie Hill, and we're continuing our IV workshop skills. We're going to hang a IV piggyback. You see, IV piggybacks are frequently abbreviated IVPB. This small bag or piggyback is also called a secondary. It can be medicines like antibiotics, steroids, electrolytes, but your primary is this bag, and it's going to hang as your secondary, okay? So we're going to learn to set that. You don't need gloves because you're not touching body fluid. Your tubing says secondary set, okay? First thing you do when you take any tubing out of a bag is to clamp it off. So first thing we're going to do is scroll this down to clamp it off, and it'll get tight. If we don't, when we connect the antibiotic, it'll go all over our feet or all over the floor, and we'll waste the patient's antibiotic. All right, listen, we're going to pull it off here. Hear it pop? Once you take this off, you don't want to touch this. It has to stay sterile. See how sharp it is? If you're not careful putting this in, then you can pierce the back and waste the antibiotic. So see how I kind of straightened it out? And you want to push it in till you get to that flanged out part right there. You want to push it in, not straight, but with a twisting motion. And it goes in real easy. Okay? Now let's turn this on and let's reset our pump. We'll just go through the steps of setting the primary again so y'all have it. New patient, yes. Med surg, yes, well, that's an area of the hospital we're at. All right, we don't have a patient ID, so we're going to exit that. It is channel A. Okay, it's a basic infusion. Our rate we said was 125. Our volume to be infused is 50 less than what's in the bag. If it was a 500 cc bag, it'd be 450. This is a 1000 cc bag, so it's 950. All right, and then we're going to set a secondary or an IV piggyback. All right, we're just a basic secondary. Our rate, the pharmacy will tell you how fast it should infuse. Most antibiotics go in over an hour or over 30 minutes. Look here, pumps deliver cc's per hour. So if the antibiotic is mixed in 100 cc's and you want it to go in an hour, the pharmacist says, you're going to set it for 100. And then your volume to be infused is 100 because you want them to get every bit of their IV piggyback. So our rate is 100. Our volume to be infused is 100. Okay. You want to connect it to your Y site. This is called a Y site. It forms a Y. Above the pump, wipe it 10 times. Okay. This has a little cap on it, so take that off. This is a two-step process. Okay. You want to push it in, then you want to twist it down. All right. Now, our tubing still has air in it. If we don't clear the air out of our line, if air goes through the pump, it'll start beeping, and the only way to get it to stop beeping is to change out all this tubing. Plus, if you give the patient air, it's called an air embolus, and it can kill them. So you've got to clear your air. But look, I'm filling it by hanging my secondary lower than my primary. When it gets in the drop chamber, I can just put it up. All right. You do want some air in here so it doesn't, fluid in here so it doesn't draw air. All right. And I want it to get it all. And now I'm going to hit start. Now, it's going at 100 cc's an hour, not 125, which my primary is. Once it infuses all the secondary, if this is open, and you want this open, then it'll kick over and start infusing the primary. And then when the primary is about out, the pump will beep. All right? Any questions on how to hang an IV piggyback? All right. And that's this skill.